Welcome to the program. I'm your host, Neil Howard. Thank you so much for joining us for another segment of Health Professional Radio. In this segment, we're going to be speaking with Dr. Todd Chappell. He's joining us here as a board-certified OBGYN to discuss a new study in the Journal of Sexual Medicine that found that women using the non-hormonal birth control method, Phexxi, reported some very positive sexual experiences. Welcome to Health Professional Radio, Dr. Chappell. Thank you for taking the time.
Thank you so much, Neil. Happy to be here.
Well, was OBGYN your first love when you decided to go into medicine?
So that is a very funny question. My mother loves to remind everyone that when I started medical school, I said I'd probably be a family physician, maybe a cardiologist, but the only thing I knew I wasn't going to do was OBGYN. What happened was when I got into my third year of medical school and we actually started doing rotations, I fell in love with surgery. But I didn't like the fact that in general surgery, you do surgery on someone, you see them for a post-op visit, and then you never get to see them again. And gynecology had the mix to where I was able to do surgery, but I also get to keep my patients from the time that they're a teenager until they're in their 80s. And so it's been great. I get to have primary care and surgery together, and delivering babies is fun too.
You experience a wide range of problems and cures and techniques and experiences throughout these patients' lives.
Absolutely. And one thing that you'll learn about any gynecologist is we really are very passionate about women's health. And too many times in history, women have been marginalized in healthcare and haven't gotten as good of care as men have. And so those of us that are in this field really like to help empower women to really focus on their health.
This study that was published in the Journal of Sexual Medicine, it examined sexual satisfaction among women who use Phexxi. It's the first and only FDA-approved on-demand prescription contraceptive gel. Talk about why this study was conducted and what the study found.
Sure. So give you a little bit of background about Phexxi. As you mentioned, it is the first FDA-approved non-hormonal on-demand prescription contraceptive gel. And this study was a branch of the study that proved its efficacy and safety in a contraceptive trial. That trial was called the Empower trial, and it was a contraceptive trial for women ages 18 to 35 who were healthy, had regular menses, using this gel either right before sex or up to an hour before in order to show contraceptive rates. And what the study showed was that Phexxi was 86% effective in typical use and even up to 93% effective with perfect use in preventing pregnancy over 7 cycles of use. So we had good data from that study, but one thing that we also wanted to look at was women's satisfaction with the product. And that's where this kind of secondary study came in that's in the Journal of Sexual Medicine. And it was looking at an exploratory endpoint of that Empower trial to look at satisfaction rates, including sexual satisfaction. And the sexual satisfaction patient-reported outcomes were assessed by a few different questions based upon the impact of a woman's sex life and utilizing 2 previously developed sexual assessment tools we have called the Sexual Function Questionnaire and the Female Sexual Function Index. And these are based on multiple different facets of sexual health and symptoms. And what this study showed was that the mean impact on sex life score significantly improved from the baseline visit when women started the study to visit 5. Also, the mean scores for that sexual function questionnaire and the female sexual function index significantly improved from baseline to visit 5. And to kind of break that down a little bit and explain what that really means, the sexual function questionnaire assesses symptoms of vaginal dryness, lack of interest or desire, tightness, pain during penetration or intercourse itself, anxiety about a woman's performance, inability to orgasm, vaginal bleeding or irritation, and increased sensitivity of the skin from intimate touching. sharp pain, and other sexual problems. And when you break down that questionnaire, the mean score that women gave significantly decreased for dryness, lack of interest or desire, tightness, pain, anxiety, inability to orgasm, and bleeding or irritation between those baseline visits and visit 5. Then that other questionnaire, the Female Sexual Function Index, assesses desire, arousal, lubrication, orgasm, satisfaction, and pain, and a higher proportion of women had no difficulty in maintaining lubrication in visits 3 through 5, and also looking at those other side effects. So overall, the majority of participants either had the same or improved scores from baseline to visit 5, but the most important thing, there was significant improvement in the mean scores of the impact on sex life and on lubrication. So this is pretty helpful for us as providers to be able to explain to patients that, hey, this is a product that's out here that helps prevent pregnancy, but also can help improve your sex life. And before this study was published by Dr. Thomas and the others, we kind of figured this because I was one of the investigators on the Empower trial. And our patients were coming in discussing how much they liked the product, that it worked very well as a lubrication, that they enjoyed sex with it. And we had a couple patients that were very upset when the trial ended because it wasn't out to market yet, and they wanted to keep using the product.
Is it the non-hormonal aspect of Phexxi that allows this level of satisfaction with the product?
So you've got a couple of issues there, and that's definitely part of it. There are many women who'd want a non-hormonal option. And so it eases their mind that this is non-hormonal, that it is an on-demand product. So something that they don't have to take daily. They can use it, like we said, just before sex or up to an hour before sex. And when you throw in the lubrication properties, it just kind of gives a nice product all in one of a few different great aspects. So women have less anxiety about it, but also get good enjoyment out of it too. And I'll be honest, when we first started the trial, some of us thought that it might be too much and be very slippery and gunky and messy. And it isn't. And the reason is it comes in an applicator that the woman inserts inside the vagina and then places inside. And it's got great bioadhesive properties. And what that means is it sticks to the surfaces of the vagina and the cervix. And that's how it works, because what Phexxi does, and this is what I have to explain to women as well, it's a vaginal pH modulator. And by doing that, it's not changing a woman's pH. It is keeping her pH where it's supposed to be. The natural environment of the vagina is to be acidic. And the reason that that changes during sex is that semen has basic properties. So the semen increases the pH to allow sperm to survive and get to an egg. Well, this coats all of the surfaces and keeps everything acidic so that the semen can't change the pH and therefore the sperm can't survive. So when you throw all of that together, I think that's what really gives these satisfaction scores.
And that's what sets Phexxi apart from other birth control methods.
Correct. The fact that, you've got non-hormonal, it's on demand, and the woman is in control of it. She doesn't have to depend on a partner to put on a condom or to do something different. She is the one that has the control.
Explain who may not be the best candidate for Phexxi.
So what we've told everyone is anybody is a potential candidate. The only thing that, someone who's already happy on their birth control method is probably not going to be interested in changing to a different method. But one thing that studies show is that many women aren't happy with their method. Anyone looking for a non-hormonal method, this is a great option. People who want to use it as a second option along with condoms, because it is it is approved to be used with condoms. And so someone who's wanting a second option that she is in control of is a great patient. But we really don't say that there's anyone that's not a good candidate. It's just most people are a good candidate, especially if they're not happy with their current method.
Give us a website where we can learn more.
Sure. The website is www.phexxi.com, and Phexxi is PHEXXI.com.
Great. Dr. Chappell, thank you so much for joining us here on Health Professional Radio. It's been a pleasure speaking with you. Lots of great information.
Thank you so much, Neil. I really appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.